considering the political, economical, social frame that is different for one of each city, we have to find out, we are trying to find out which are the best tools to engage population, citizens in this co-creation, in this participation of new answers for the new demands of the health sector. Regarding Igualada, we do not have a very strong health sector or identified a strong health sector business and companies in our city. But through a tool like the 4D Health Innovation Simulation Center, we can achieve to attract health sector companies and also to develop new business opportunities. This means that by mixing knowledge and innovation, this will make for sure an attractive point to the companies that may influence on her decision by choosing the location of maybe new establishments or so on.
So in Leeds, we've been really busy working with our local businesses. We've run events to listen to them, to understand their needs in relation to innovation in our health system and accessing our health system. We have also involved them in events to do something to actually improve training and simulation in the Leeds health system. So those events have been very successful and we aim to build on them over the next year, and we're very influenced by what we've been doing in Urbact. We're feeding our learnings from Urbact into our process of engaging with businesses.
In the last years, several organizations in Novara, both in public and private sector, started to run a network with the aim to foster collaborations between the health and the science sector with business and companies. So some new companies, new startups are spinning out from university, as well as the traditional companies are switching a little bit their focus on the new sectors like nutrition or biotech. And what we expect from the future, just to going on with this process, because we really believe it could be the only way, the right way to make Novara a new pole, a new center for excellency in autoimmune disease and in health all over north of Italy.
Tartu is a very young and vibrant university city. There are a lot of young people and there is a very well developed education system. And what we want to achieve with the 4D Cities project is to develop further the chain of entrepreneurship, so the young people would stay to the city and to the area and they would establish their companies, and we would have something to offer for the competent young people and also for the older people in the area of health tourism and medicine sector. And therefore we address the economical situation and trying to create more workplaces and make the region even more attractive.
Health, recreation and tourism are the main priorities of Plungė district municipality. Because of the nature, unique nature, lakes, forests, our business infrastructure is located around the biggest lake in a district, Plateliai Lake. Municipality also invests in this region a lot. Due to the 4D Cities project, we want to improve the health of our citizens because of this infrastructure, and we want to involve business into development of this infrastructure to help people start their business, to develop their business, which is linked to tourism, recreation and health.
So from the beginning of the projects, we're trying to come to a model where they can easily get access to the healthcare market, and that they don't have to enter the market every time with every single healthcare provider, but that we create an open platform for them where all the healthcare companies, whether the healthcare providers and the welfare providers work together in one shared service center where they share their infrastructure and technology, and in that way it is for SMEs more easily to access that service, and that they can easily plug in their ICT solutions, whether it's communication on a distance or whether it are sensors or remote surveillance or just technology that stimulates or that supports people to stay in their own houses for a long time, and that they can easily make a connection with these healthcare providers.
The relation between health and business is a very strong one in Jena. Due to a long tradition in medicine and medical technology, there are numerous medical device companies situated in Jena. These medical device companies and all other companies from the medicine and health sector are very active in research and innovation, providing employment to the skilled and highly skilled citizens. Medical device companies also have a very high export quota, so these companies and all the other companies from that sector provide high tax income to the city of Jena. The University Hospital also plays an important role as the biggest employer in the region. Out of the high number of people working in services in Jena, the majority is employed in health and health-related jobs. So all in all, the relation between health and business is already a very strong and good one in Jena.
The current approach regarding the business and the social sector and the health sector is now a classical one. There are few service providers in that field related to health, but with very low interaction in proposing new approaches. So we are working on user local meeting groups, and we are inviting the local companies, NGOs also, and small companies in order to make them know what we are preparing in social politics, in health politics. And we are trying to involve them in projects, in trainings, programs, in generating common approaches. And we have at least 5 or 6, we had at least 5 or 6 meetings in which they came, they told us their needs, the municipality told their needs, and I think that we are on a good common road now.
In Doven, the meeting was focused on the business sector, the private business sector of the health innovation projects, so the role they play. And it was evident that the local government and the development agencies also, they play a crucial role in supporting the private business sector by letting them know the opportunities and the needs of the health sector, by facilitating networking activities through fairs, events, and also by allowing them and letting them interact with other health actors, mainly the patients and the knowledge sector. Another very important point, I think, was understanding the role that the small companies, the SMEs and the startups, especially from the ICT sector, they have a key role because the new sector activities around e-health and mobile health, they count very much on these type of companies, and they adapt very well to these type of activities. So I think these were the main learnings of the cities in Eindhoven. So, and in the case of Eindhoven, we could see how they have this, the way they support the service companies in the health sector, because this is a strength of the local and regional economic activity.
Private sector and companies can collaborate with the healthcare system and social system, not only in terms of investment and returns, but also sharing their knowledge with all the stakeholders. Concerning the implied stakeholders, the citizens must be considered as the center.